Hello, future nurse aides. Accurate measurement and recording of a resident's physical findings is a core responsibility. Today, we're mastering Module AA, Measurement. Vital signs, often called TPR and BP, are measurable variables that indicate a resident's general condition. They can signal emergencies or show how a resident is responding to treatment. Never forget that pain is considered the fifth vital sign. It is subjective. It is whatever the patient says it is. Your role is to identify the level and report it to your nurse. Use a pain scale like the Wong-Baker FACES scale to help residents communicate their discomfort. Always report abnormal findings immediately according to your facility's policy. Accuracy is critical when taking vital signs. You'll need an analog watch with a second hand to count pulse and respirations for a full 60 seconds. Don't forget your notepad and pen. Body temperature helps us identify immune system issues. We measure it at several sites: the mouth, rectum, armpit, ear, or forehead. Always check the care plan for the correct site. Normal values vary by site. Oral baseline is 98.6. Rectal is typically 1 degree higher, while axillary readings are usually 1 degree lower than oral. Whether using digital or electronic thermometers, always use a probe cover. For glass thermometers, green tips are oral and red tips are rectal. When reading a glass thermometer at eye level, long lines represent 1 degree and short lines represent 2/10 of a degree. Practice reading these precisely every time. Safety is paramount. Never take an oral temperature if a resident is unconscious, has mouth sores, or recently had facial surgery. Choose an alternative site for their safety. Pulse is the heartbeat felt at an artery. We assess for rate, rhythm, and force. While many sites exist, the radial pulse at the wrist is our standard for routine checks. To take a radial pulse, place your first 2 or 3 fingers over the artery on the thumb side of the wrist. Count the beats for a full 60 seconds for total accuracy. A normal adult pulse is 60 to 100 beats per minute, regular and strong. Document your findings immediately and notify your nurse if the pulse is abnormal. Respiration includes 1 inspiration and 1 expiration. Normal breathing, or eupnea, is regular and quiet with a range of 12 to 20 breaths per minute. Pro tip: use the stealth technique. Count respirations immediately after the pulse without moving your hand. Residents may change their breathing if they know you're watching. Blood pressure measures heart force. Systolic is the contraction pressure, and diastolic is the resting pressure. Normal is under 120 over 80 millimeters of mercury. Your stethoscope must be clean and functional. Ensure the earpieces point forward toward your nose and use the diaphragm side for checking blood flow during pressure readings. The BP cuff, or sphygmomanometer, has a manometer gauge. Watch the needle carefully as it drops. Long lines are 10 units and short lines represent 2. Count backwards precisely. Placement matters. Wrap the cuff on a bare arm 1 inch above the elbow. Ensure the resident's back is supported and their legs are not crossed for an accurate reading. When checking for orthostatic hypotension, measure blood pressure while the resident is lying, sitting, and finally standing, waiting 2 minutes between each position. Height and weight reflect a resident's nutritional status. Always aim for consistency. Use the same scale at the same time of day, preferably before breakfast, in similar clothing. Master the parts of the mechanical beam scale. This includes the upper and lower poise bars, weight indicators, and the height rod with upper and lower sections. Read height to the nearest 1/4 inch. To convert to feet and inches, divide the total inches by 12. For example, 68 inches is 5 feet 8 inches. Intake and output, or I and O, tracks fluid balance. Fluids are measured in milliliters or cubic centimeters. They are the same unit. Accuracy in fluid tracking is vital. In healthcare, we convert ounces to milliliters by multiplying by 30. An 8-ounce glass of juice is exactly 240 milliliters. Master these conversions. Use a graduate at eye level on a flat surface for measuring. Know your facility's typical serving sizes, like a standard coffee cup or milk carton holding 240 milliliters. Output includes urine, vomitus, and wound drainage. Use devices like urinals or catheter bags to collect and measure output precisely in milliliters at the end of every shift. We track food intake in percentages. A quarter of the meal is 25%. Document as poor, fair, or good based on your facility's specific policy. You've completed Module AA. Your precision in these measurements is the key to resident safety and quality care. Practice these techniques until they are second nature. Thank you for learning with OJM Consulting and Coaching. We're here to support your clinical journey every step of the way. See you in the next module.